If I'm a researcher, a clinician, or a sponsor, we're each going to have our own lens. So, what actionable lessons do you think I would pick up from your upcoming poster session at the Clinical Trials in Alzheimer's Disease Conference?
So I would hope that a researcher would look and notice some of the treatments that failed, and say, oh, maybe this is some, there's a promising, something promising along this type of treatment, that can be used. If I'm a sponsor, I guess kind of the same sort of thing. But sponsors specifically would have the responsibility to make sure that they're not following the same design issues that that led to this. That they would have a little courage in choosing their outcomes, and not just go the safest route, especially in phase 2 studies. But I would say even in phase 3 studies, one of the greatest mixed results for me in recent history was the fact that donanemab with Eli Lilly succeeded on both iADRS and on CDR sum of boxes, which is great, and exactly the result that I hoped for, except for one thing. Their primary outcome was not CDR sum of boxes. Their primary outcome was iADRS, a composite score. But as soon as they hit on CDR sum of boxes, they could emphasize CDR sum of boxes because that they knew that the CDR sum of boxes had found favor with regulators in the past. I would have, in some ways, it would have helped the field as much to have them hit only on iADRS, so that they would have to get the FDA to weigh in on the acceptability of a composite score like iADRS, and either approve or not approve based on iADRS alone, because by making that happen, it would have led to a greater number of trials that hopefully would be allowed to use better outcomes as their primary outcome, so that we would have a better chance of seeing these successes. So that's what I want to see from sponsors. From clinicians, well, what's interesting is I was in Korea not too long ago, and one of the treatments that they assign to patients as soon as they are diagnosed with Alzheimer's disease is choline alphosphorate. But also interesting about that is the fact that the government is now requiring them to have more definitive clinical studies to demonstrate the efficacy of choline alphosphorate. And I think a lot of the clinicians are thinking that it's not that they might not get success on that trial, although I suspect that they will. And so I think clinicians should know that there may be more treatments out there that are safe and effective. Specifically, they might look at some of these things like the ginkgo biloba and boswellic acids, and I'm afraid I don't remember the third one right now, but look at some of these supplements and understand that they were at least as effective as some of the treatments that are being prescribed to patients right now.